Welcome to the Allied Health Professionals podcast series
with your hosts, Jennifer Trafford
and Alison Kerr. Hello everyone and thanks for tuning in. Today we're at James Cook's site and we are talking all about ODPs. And today we have
Si Jackson.
And we've also got Jennifer Trafford, our co-host, who is an ODP. So I am outnumbered by operating department practitioners today, which is awesome. How did you get into the profession?
So originally, when I was a teenager, I kind of was like, didn't know what I wanted to do. And then went to college and did adult health and then kind of thought, where can I go? And my auntie, who's a radiographer, she kind of said, have you ever heard about an ODP? And I was kind of like, no, I've never heard of one. Looked into the profession, kind of thought, oh yeah, it sounds interesting. But in my head, I was thinking I might want to be a paramedic. Don't know. Looked at that, kind of weighed up my options and then thought, actually, I probably look more into the ODP side of things. Applied. I wasn't a first-time applier. I was the third-time attempt to get onto the course, which was surprising for myself because normally I'm pretty awesome. But didn't get on first, second time, but third time was the charm. Got on, and then that's where I've been ever since.
Yeah, well, third time's lucky, yeah.
Absolutely.
And it just means you definitely want to get on the course, and that's what people have to do, keep pushing and keep pushing.
Yeah, you have to admit, that's the thing is for those people out there that don't get it first time, you're a real example of, like, persistence is the key because you now not only are an ODP, but you are an educator within the theatre department as well, aren't you?
Yeah, so been an ODP for 7 years. And I've enjoyed every minute of it. I've always predominantly worked in anaesthetics and recovery side of the ODP role. Did do a bit of scrub when I worked in a different trust, but now I've kind of advanced on to being a clinical educator in the theatre department and predominantly looking after students as my job, but I do clinical shifts as part of that.
As a non-ODP, could you explain the difference between scrub, anaesthetics and recovery?
Yeah. So when you train, you have to cover all aspects of an ODP role, which covers scrub. So the scrub side of things is working in the theatre alongside your surgeons, your first assistants at the table, scrubbed up, maintaining the sterile field. It's your responsibility to maintain and account for all equipment and kit and the safety of that patient during the procedure. And as an anaesthetic ODP, we look after the patient through the anaesthetic phase, so popping the patient off to sleep, as we say, a bit more complex than just popping them off to sleep. But pop them off to sleep, look after them during the whole procedure, making sure that all the parameters, the observations and everything like that stay stable during. And then afterwards you go into recovery and you make sure that the patient wakes up from the anaesthetic safely so that you can get them back to the ward to be discharged, or if they have to stay for a little bit longer.
About you, but when I started my training, I thought that I would spend all my time in the theatre. That would be my whole world. I was quite surprised when we started how much of outside the theatre that we dip into as well.
Yeah, so part of your training, you kind of see little glimpses of things and you're kind of like, do we do this normally? Is this a normal part of the role? And you soon kind of find out that ODPs are kind of used a lot throughout the hospital and the trust, which you don't kind of realise or know about until you kind of work there. So we do a lot. We go to resus for like trauma calls, that's peds and adults. We also attend airway emergencies on wards throughout the hospital. We also go down to obstetrics for caesarean sections. We also go to Rosebery Park as part of our training for ECT treatment, which was a shock to me because when I trained, we didn't do ECT treatment in the hospital that we where I trained, and then when I came to James Cook and I had to go to ECT for the first time, it was a bit of a shock.
Yeah, I have to admit, my very first day as a student, day one, and I turned up on anaesthetics, and they said to me, "Oh no, you don't need your scrub uniform on, and go and put your clothes back on because you're going to Rosebery Park." And I was like, "What?" And we went over, and my very first day was me seeing somebody have electric shock therapy on my very first day as a student. And I thought, what have I got myself into here? And it's amazing because actually, if you go over there often enough, you see patients that are coming in from day one, where they come in almost catatonic, don't they?
Yeah.
And by the time you've finished by week 4, 5, 6, 7, they're not fully functioning, but they're at least coming in and recognising you and saying hello to you, and having some movement. And it was a real eye opener for me that we were part of that.
Yeah, it was a shock to my system seeing it for the first time.
Yeah, excuse the few puns that you're throwing in here.
Yeah. Not intentional. But other than that, yeah, so we kind of are used a lot around the hospital, and we go to neuroradiology, we go down to endovascular radiology, we also do MRI lists with paediatrics and adults now. And we also do endoscopy.
You didn't train with us at South Tees, did you?
No.
Do you want to tell them where you came from and what your background is from there?
Well, originally, before I did my training, I got a volunteer's role within James Cook, and I volunteered through the therapeutic care volunteer program that they ran. And through that, I kind of got my way into cardiothoracic theatres. So I kind of worked there as a healthcare, but free because I was a volunteer, which then kind of stamped the deal for me, shall we say, to say, yeah, I definitely want to work in theatres. And from that, then I started my training and then moved on to Darlington Memorial Hospital in Bishop Auckland, and that's where I did my training. Then after qualifying, I stayed there for a couple of years just to kind of get my feet definitely under the table and kind of settled and comfortable. I wouldn't say confident, because I don't think you can ever be confident in anaesthetics because it's a very kind of unpredictable area that you work in. And then eventually applied to come over to James Cook because I live closer here really, and thought, yeah, I'll do that. Then I came here, and then I was here I came the week before COVID. So that was a bit of a shock to my system because I came expecting to have like an induction and kind of learn where the things are in the hospital, which never come to fruition because of COVID. So I kind of just had to kind of get on with the job, even though I'd never been in the trust working in that department before.
I think COVID, that is a really good example of how you've just come in to an unpredictable situation. You just had to adapt and get on and do it. And really that is being an ODP, isn't it?
Yeah.
And just coming into that really unusual situation, but just cracking on, doing what you need to do.
I think it was one of them situations as well that really highlighted to the trust our transferable skills, especially the anaesthetic and recovery element of it, because of our airway knowledge.
Yeah. And we also kind of got moved into critical care during that period to assist and help as best we could. But it is an area where we kind of have a bit of knowledge on the drugs that they use in critical care and also the ventilation side of things.
So before COVID, you wouldn't normally work in critical care, so that opened up that avenue of possibly working in there as an ODP in the future.
Yes, but unfortunately, in the trust, they don't employ ODPs in critical care.
Do they do that in other centres?
In other centres across the country, they do actually hire ODPs in critical care and in resus in A&E.
Oh, that's really interesting. I didn't realise that.
We are getting out of theatres a bit more, and people are starting to see the potential of our profession and the kind of cross skills that we have, because we now have ODPs in pain management, don't we?
Yes. So one of our ODPs went there a few years ago to cover, just for maternity cover, I think it was. But they've kept her in the pain management team, which is quite a good stepping stone for people for different avenues to take a profession somewhere.
Yeah, we've got another one that's gone into the digital skills team.
Yes.
Stuart.
Yes, he's went there, and that was a secondment for a certain amount of months, but he enjoyed it, and I think the team liked having him there because he's very technological minded, should we say. So he's kind of stayed there because he loves it.
And wouldn't you say that again, that links with us as ODPs, because we are very patient centres, but our job is very technical as well, isn't it? Because of the equipment that we use, the likes of the anaesthetic machines and Belmonts and cell savers and things like that. We have to have a real technical mind.
Yeah, and very much so at the minute, because a lot of our systems have gone electronic. So a lot of our observation monitors and things for the anaesthetic machine all gets linked to a system that we have in theatres now. So a lot of the observations go on there, your blood pressures, your heart rates, everything. So it's kind of another to make sure that that's actually linked up properly, and actually the patient's, that is actually a true representation of what the patient is actually, their observations at the time. Kind of.
What made you choose? So here at South Tees, when we qualify, once we've qualified, so as training, we learn all three elements of the theatre environment, don't we? The scrub, anaesthetics, and recovery. But once we've qualified, we're generally asked to choose between scrub and anaesthetics and recovery. I know you chose anaesthetics and recovery. Why did you choose that over the scrub?
Well, it wasn't so much a choice in the sense. So when we come to the end of our training, there was jobs available. We didn't necessarily have to apply for the jobs. They kind of said, you've trained here for the 2 years. At the time, it was a diploma, 2 years. They said, we'd like to offer you a job. And it was the band 7s for scrub and anaesthetics that fought for who they wanted. So anaesthetics normally used to get the raw deal in the second choice. This was at Darlington Hospital. But they kind of fought and said, no, we want first choice. So they had chose me, which was a surprise because I was very scrub orientated. I did like scrub because I'm a very anal person, should I say, if I'm allowed to say that.
I think your ADHD kicks in when you're sat at a scrub table.
Yes, so I like things in order, in its place, where it has to be. So I was very scrub orientated, and then when they offered me the job on anaesthetics, I was a bit kind of taken aback and thought, is that the area for me? And then thought, I do enjoy it, but I think I like scrub more. And I thought, well, they must see something in me that I don't see. You know, he's always self-critical and things. So I thought, right, I'll give it a go. But there was a lady who I trained with who she said, well, I'll swap with you in 6 months if you're not feeling it. So I had that kind of backup. So I thought, yeah, let's go for it. So I did it and then thought, actually, I'm glad I chose anaesthetic. Well, I chose anaesthetics after I was chosen for anaesthetics, shall I say. But at the time, because of staffing levels and things like that, there was still scope for me to scrub at the same time. So I used to do scrub and anaesthetics alongside each other. But my primary job was mainly in anaesthetics. But I did enjoy the scrub side of things. But then kind of that's stuck now, and I don't think I'd move back.
At Darlington, you were allowed to do both, weren't you, though, and keep that skill mix together?
So it wasn't a kind of a normal thing, shall we say. So it wasn't kind of like a routine thing where people got to scrub and do anaesthetics. It was more so due to staffing levels, but it wasn't kind of thing where you were kind of primarily in anaesthetics, but you would do the scrub side of things, but you wouldn't do any complex scrub things, just to make sure that you are kind of working within the parameters of your ability and safe for the patient. So you would only do stuff that you were kind of confident and competent in doing. So it was kind of a buffer, but it wasn't the norm for people, and only certain people liked doing it. Wasn't a lot of people that liked doing it because they were very set. I like anaesthetics. I like scrub. There is this invisible divide between anaesthetics and scrub. Depends which one you work on. If you work in anaesthetics, you say scrub is the dark side.
Yeah.
And if you work on scrub, you say anaesthetics is the dark side. But everybody knows scrub is the dark side.
It's been podcasted now, isn't it? So as an ODP, and as I'm working in the workforce for allied health professionals, often people will ask me what the difference is between an ODP and a nurse. So how would you summarise that?
So really, it's just the title and the registration, who you registered with, shall I say. So as an ODP and as a nurse, once you qualify as, well, once you've got your PIN, you're a band 5. A nurse is registered under the NMC, and a ODP is registered under the HCPC. And in theatre, that is the main difference. You just registered through a different registered body. We do the same job, we do the same role. It's just you've either got a title of a nurse or a title of an ODP. But I think some people in the kind of out in the trust have the belief that the nurses are they're the leads in theatre, and then the ODPs are kind of the support. but it's not, we're on level peggings,
Yeah.
as you would say, as in the job role itself.
I think the biggest difference is that as ODPs, we actually train specifically for theatres. So with a nurse, their training would take them onto all the wards, into the community settings. They would have that experience of the nursing world. And then when they come to theatres, they then have to do extra training to become theatre trained, because you can imagine theatres are very different to a ward setting. For the ODPs, we only train for theatres when we come in from day one. That's our training packages, theatres. So, and then while we're in theatres, we do all three elements of. So even when you're qualified and you're choosing between the anaesthetics and the recovery, you at least have had a few years where you have done both, all three elements. So you can appreciate what your scrub colleagues are going through, even as an anaesthetic person. I can fully understand what my scrub colleagues are going through, and I'm able to dip in and help them with, be a circulating person. So being that person that hands into the sterile environment, because I can watch and I can almost anticipate what they need at the same way as everybody, the other ODPs in the room, because we have that kind of intimate knowledge of what it's like to be in that area. Where the nurses, when they come and they choose to be scrub or anaesthetic, and then they train to be within that field. But if you're trained in scrub, they will have never experienced working as an anaesthetic person, so they won't understand when the anaesthetic ODP or the anaesthetic nurse is maybe having a problem. They maybe won't pick up on it as much as the ODP would, because the ODP has the experience of being in that environment when they were training within that area.
Yeah. And as an ODP, you kind of pick up on different noises, which sounds strange, but a lot of the machines that we use in theatres all make a specific noise, shall I say. Even the surgeons themselves make a specific noise. And anaesthetists make a specific noise. So you can kind of pick up on them noises, whether kind of, oh, something's not right, something's going wrong, someone needs a hand. So what do we need to do here? We might need to pause and think about the situation that we're in and kind of try to deduct anything that's irrelevant at the moment. This needs to be the priority currently. So it is a strange thing to say, that you just listen for noises. But the nurses on the ward, they'll probably say the same. They'll probably say on a ward, we're listening for like certain things. Like for you are probably listening for a patient going quiet.
Mm.
In theatre, all of our patients are quiet because they're under a general anaesthetic. But it's generally the noises of the machines that change, the tones of the machines that change. And then we're kind of looking, thinking, right, something's not right. So then we would step in. So I think coming from a ward, it is a completely different aspect. And don't get me wrong, the nurses do an amazing job on the wards. For myself, if I went on the ward, I'd be like a deer in headlights, probably thinking, oh, that looks fine to me. But because in theatres, even looking at patients' observations and parameters, they are slightly askew because of the operations and the drugs that we've had to give them. Whereas on a ward, if I was seeing them observations, I'd probably say, oh yeah, that looks okay. But for a ward nurse, she'd be going, oh no, this would trigger on our new score. So I think that is kind of the difference. So a nurse coming into theatres, it is a big change of mindset from what you're looking at as a patient on a ward to how you're looking after a patient in theatre. It's very different. I think some people don't realise that until they come, and then they go, oh yes, it is very different. Like, yes, it is. But listen for the noise.
I feel like we need to do a whole podcast on machine noises, because I feel like we could get some scanners in there. I recognise that sound.
Yeah,
absolutely. Thank you so much for coming and spending a bit of time with us and talking a little bit about ODPs, and I'm really happy that we've been able to kind of get this one in, because I'm going to say up ODPs.
Yeah, ODPs. I mean, I'm an honorary ODP for this podcast, but it's been great. I think as ODPs as well, I think we really need to shout about what you can do, because it's fantastic. And just everything that you've just said there is mind-blowing to me, who's not an ODP. And I spent a bit of time in theatres. I came up and spent some time, and it is absolutely amazing the skills that you have. So very much.
You're very welcome.
So thank you for joining us today. Look after yourselves.
And each other.